Hello! Welcome to today's lesson on the use of radiation in PET scanners. Today we will explain how PET scanners work, including the role of radioactive isotopes, positron emission, and gamma ray detection in producing detailed medical images. Then we will describe why short half-life isotopes are crucial for effective imaging and patient safety in PET scans, as well as the logistical considerations involved in their use. So far, we have explored radiation damage, contamination, and the uses of radiation, such as in tracers. This knowledge is crucial as it provides a foundational understanding of how radiation interacts with matter and the potential implications for human health. By building on this foundation, we can delve into the sophisticated application of radiation in medical imaging with PET scanners. This lesson will advance our understanding of how physics principles are applied in real-world medical technologies to significantly improve healthcare outcomes. Let's get started. So, what are PET scanners? PET, or Positron Emission Tomography scanners, are sophisticated medical imaging devices used to detect and visualize specific activity within the body, such as the metabolism of glucose or the synthesis of proteins. This non-invasive technology allows physicians to gain detailed insights into various physiological and pathological processes, making it invaluable in the diagnosis and monitoring of medical conditions like cancer, neurological disorders, and heart diseases. PET scanners operate by utilizing radioactive isotopes like fluorine-18, F18, or carbon-11, C11. The process begins with the injection of a radioactive tracer into the patient's body. This tracer is a molecule similar to a substance naturally used by cells, but it is labeled with a radioactive isotope. Once inside the body, the radioactive isotopes decay and emit positrons. Remember that positrons are like an electron's positively charged cousin. When these positrons encounter electrons within the body, they undergo a process called mutual annihilation. This annihilation process results in the production of two gamma rays, which travel in opposite directions. The generation of these gamma rays is a crucial aspect of PET imaging, as they provide the signals needed to produce detailed images. Special detectors arranged around the patient in the PET scanner detect the gamma rays as they exit the body. These detectors capture the gamma rays' arrival times and locations, allowing the system to compute the precise point where annihilation occurred inside the body. The data gathered from these collisions is then used to reconstruct detailed, three-dimensional images of the internal activity. These images show how tissues and organs use the tracer, which can indicate the presence of disease or abnormalities based on variations in metabolism or biological activity. To ensure both safety and efficacy, the radioactive isotopes used in PET scanners must have a short half-life. The short half-life guarantees that there is maximum radioactivity at the time of the scan, which enhances image quality. More importantly, the isotopes decay rapidly, so there is minimal residual radioactivity in the patient's body after the procedure, reducing potential health risks. Given their short half-life, radioactive isotopes need to be produced close to the hospital where the PET scan will take place. These isotopes are often manufactured in a cyclotron and then promptly transported to the medical facility. This logistical consideration ensures that the isotopes retain their activity for the duration of the scan. PET scans are designed with patient safety in mind, utilizing several key measures to minimize radiation exposure. The radioactive tracers used have a short half-life, which ensures that they decay rapidly, reducing the duration of radiation exposure. Additionally, the amount of radioactive tracer administered is carefully calculated to be the minimum required for accurate imaging. The precision of the PET scanner's detectors and imaging technology further ensures that detailed images can be obtained with the lowest possible dose of radiation. Moreover, the entire procedure is closely monitored by trained medical professionals to ensure both the safety and effectiveness of the scan, minimizing any potential risks to the patient. In today's lesson, we delved into the use of radiation in positron emission tomography scanners, focusing on its application within medical imaging and diagnosis. We began by understanding the basics of PET scanners, which utilize positron-emitting radioisotopes to produce detailed images of the body's internal structures. We learned that radioisotopes, introduced into the body through a tracer, emit positrons that interact with electrons, resulting in the emission of gamma rays, which are then detected and used to reconstruct images, providing valuable information about the physiological function of tissues and organs. We also discussed the safety measures and precision involved in using PET scans to minimize exposure to radiation. By the end of the lesson, we appreciated how PET scanners combine principles of nuclear radiation to revolutionize diagnostic techniques in medicine.